Hello and welcome. I'm Patty Keenly, and I've shared a short summary of my professional background at the end of these slides. The title of the presentation that we'll do today is Complexity of Medication Errors, a Case Study Introduction. This is the relevant financial disclosure for this presentation. Here are the learning objectives that we'll address. I'd like to bring in some key definitions that we'll be talking about throughout this program. Active failures are those that occur at the point of contact between a human, so we're involved in that, and some aspect of a larger system. A latent failure is something that's less apparent. It's usually a system issue. So it's a failure of the organization, design, or the management that contribute to the occurrence of an error or allow them to cause harm to patients. And then there's a good catch. We used to call these near misses, but the more contemporary term is good catch. So it's an error process that's stopped or interrupted before it reaches the patient, either by chance or through a check and balance in the medication use process. Well, let's look at a self-assessment question. So which of the following statements about medication errors is accurate? Errors happen repeatedly because of unsafe behaviors. Errors are often multifactorial. Most errors involved either active or latent failures, or inquiries into medication errors should focus on the individuals involved and not include an evaluation of the medication use system. Well, let's consider a real case, and it goes back a little while to 1996, but it's one that's very indicative of what can go wrong in a system. So a healthy baby boy was born. However, there was concern that the child might have acquired congenital syphilis. His mother had a history of syphilis, and it was unknown if she had been treated. The mother's medical history was difficult to obtain because both she and the baby's father spoke only Spanish. To be prudent, an order was written for a non-formulary medication that said benzathine pen G 150,000 U IM times 1. The pharmacist prepared and dispensed 2 syringes of Permapen, 1.2 million units per 2 ml, in a plastic bag with directions to administer 2.5 mils of the medication to equal 1,500,000 units. The infant's primary nurse, concerned about administering such a large volume of a parenteral medication using 5 separate syringes, consulted a nurse practitioner, and the order was changed to IV push to avoid multiple painful IM injections. After administration of approximately 1.8 mils of the benzathine penicillin G intravenously, the neonate became unresponsive and resuscitation efforts were unsuccessful. Following the death of the infant, the 3 nurses involved in this care were indicted by the district attorney for criminally negligent homicide. The nurse practitioner and the nursery nurse accepted a guilty plea prior to the trial, but the 3rd nurse stood trial facing a 3 to 5 year jail sentence and permanent loss of licensure. When hearing about such a tragic case, as healthcare professionals, we're left with many questions. How did this happen? What went wrong? Who is to blame? Can this happen again? But more importantly, how do we prevent similar errors? So in looking at this and all of those questions we just mentioned, how did it happen? What went wrong? Who is to blame and were they punished? Has it happened before? Can it happen again? But again, most importantly, how do we prevent those similar errors? Well, I always like to look at the medication use system as a cycle. It starts with selecting our meds, storing them appropriately, ordering them correctly, dispensing them with all of the things we need to do, certainly administering them, and it might be the patient or it might be a caregiver who does that, and then monitoring what's happening. Well, we want to take a look at where errors occur. And if we loop back to those definitions of active, meaning we're involved as humans, or latent, which may be more hidden in a system, those type of failures, and meshing that with those 6 steps in the medication use system and that cycle we just looked at, you can take a look at some of these things. Well, selecting, what could go wrong? Well, if we're involved, we could have lack of knowledge about the drug, but a more hidden issue might be incomplete information. When we're talking about storage, we may do it at the incorrect temperature, but maybe again, hidden, incomplete information. How about ordering? We could pick the wrong drug, and the latent issue there is that we lack the full patient information that we need. For dispensing, we could make a calculation error, or a more hidden thing would be that we have ignoring warnings on those. How about administering? We might mix incompatible drugs, or latent issues might be an unclear policy. And monitoring, we might have insufficient information, and again, an unclear policy might be a latent contributor to that. We want to take a look at how complex systems fail, and certainly the medication use system is complex, right? Well, this is some information that's been done over the years by James Reason, and you can see why it's called the Swiss cheese model. Because what happens is we have hazards in pretty much everything we do, right? But what we want to do is avoid those Swiss cheese slices from lining up. Some of those holes are due to active failures, and some are due to latent conditions that are there. But what we want to do is put in enough baffles in that system so that that arrow doesn't reach all the way through, and we have ways of stopping those errors before they occur. Well, let's take a look at the MedUse system again and some key elements. And you can see 10 of them listed here. We need patient information. We need drug information. We need appropriate and adequate communication of orders and other drug info. We have to label and package and make sure that nomenclature is correct. We need drug standardization and storage and distribution issues. We certainly want medication delivery device acquisition, use, and monitoring is almost as important as the drug. We have to make sure that that medication gets into the patient correctly as well, using whatever device is involved. There are environmental factors involved. We have staff competency and education to consider, as well as patient information, and then wrapping up that whole process, a quality process and risk management for our systems. So what's been your experience to date? How have errors been identified and analyzed at your organization? Is there a comprehensive approach, or is it more siloed? Does the culture support reporting errors, or is that something that's been hidden because issues aren't handled well? And when are good catches? When they're identified, are changes made to improve the system? Let's loop back to the self-assessment question that we had in the beginning. So which of the following statements about med errors is accurate? Is it that errors happen repeatedly because of unsafe behaviors? Is it that errors are often multifactorial? Do most errors involve either active or latent failures? Or do inquiries into medication errors focus on the individuals involved and not include an evaluation of the medication use system? You can see that the correct answer is that errors are often multifactorial. We have active and latent issues in there. We hopefully have some good catches to avoid some of those errors, but the whole process is really quite complex. Completion of the program is going to provide you with some insight into the nature of the culture of safety, the nature of errors and of human factors, as well as ways to identify and control medication safety risk and implement some high leverage prevention strategies to prevent harm. So what we want to talk about and acknowledge is that errors occur throughout the medication use process. They are generally multifactorial in nature. Many of the errors involve both latent and active failures, and they certainly can occur because of the complexity of the medication use process. This is the reference used that I mentioned. Thanks very much for your time and participation